This is Caring for You from the Waupaca Senior Center.
Okay, so I'm Denise Ross, and I'm from Waupaca Hometown Pharmacy. There's some familiar faces here, so it's always good to see people that I know. And you can feel free to interrupt me at any time. Just kind of wave me down if you want me to stop and you have a question about anything. But I'm just going to talk a little bit today about just some vaccine information that is good for people to know. I think we'll start talking about the shingles vaccine because that seems to be one that a lot of people have questions about. Not everyone gets it. And included in the little packet of papers that I gave you is this sheet that says, talk to your hometown pharmacist today if you qualify for the shingles vaccine. Shingles is, you can get shingles if you have had chicken pox in the past. If you've had shingles before, you can get shingles again. Even if you have had a mild case of shingles, if you've had shingles multiple times, people can get shingles over and over and over. It tends to be a very painful virus. It's actually a virus, so it's not treated with antibiotics or anything like that. So it can be painful, it can be itchy, and it generally affects only one side of the body because it follows the nerve line. So it affects the face sometimes, which can be very dangerous, especially for eye health, things like that. And the facial nerves run through all these little tiny bony canals, and if the virus affects those nerves, it can cause some paralysis in the face and things like that. So shingles, even though some people get a very mild case of it, can be very serious. And the symptoms are generally like chicken pox. They look just like little blisters. Sometimes people get just kind of a tingly type sensation. Mary, do you want to tell about your experience at all? No?
I don't want.
You don't want to rethink about it at all?
Question about it.
Sure.
When you have the shingle shot,
Yes.
how often do you have to have that?
As of right now, it's just recommended one time.
The shot isn't bad.
No.
If the shingles come back, do they come back in the same area, or can you have them anywhere in the body?
You can have them anywhere in the body.
Okay.
What brings it on?
So I have it on my face.
Well, stress a lot of the times causes it. If you've been sick and, that kind of stresses the body. They don't know.
Do you get Bell's palsy from that then too?
You can get Bell's palsy. So Bell's palsy, that's what I was talking about, the facial paralysis.
I thought
Mhm.
palsy, I heard of that happening.
Right, and so it usually affects only one side though, one side or the other, because your spinal cord obviously runs down the middle of your back and that separates, so your nerve lines run then around from your spine so that generally you only get it on one side of the body or the other. That doesn't mean that the next time you get it, you can't get it on the other side of the body. It's a virus, and once you've had the shingles virus, or the chickenpox virus at all, then that virus just generally lays dormant in your body, not giving you any symptoms unless there's some sort of, immune thing that, stresses your body and stresses your immune system and things like that, and that's where these things can pop up.
You've never had chicken pox.
Well, if you've never had chickenpox, you should maybe talk to your doctor about getting the chickenpox vaccine, because chickenpox is very dangerous for an adult especially, just because the symptoms are generally more severe. Most people got them, I got them when I was 5, I think, something like that. The other thing that you may want to do is ask your doctor to run what they call a titer. so they can do a titer, because maybe you had a very mild form of chickenpox and you don't know it. And so they can run a titer to see if you have any chickenpox antibodies, because your body produces antibodies. Anytime we're sick, your body produces antibodies to fight off whatever illness that is. And so whether it's, measles, mumps, the chickenpox, all of those kind of things, they can run what they call a titer, where they check for levels of that virus antibodies in your blood. And it might be worth checking, because a lot of, there are people that have had very mild cases of chickenpox, when they were young, and, you don't know. I mean, our parents aren't always the best historians. I know my brain isn't always.
I just had mumps and measles.
Yeah. I mean, I just know that, as far as I go, my kids now have been vaccinated against the chickenpox, because now there's a chickenpox vaccine. But it may be worth looking into to see
How reliable is that vaccine?
how reliable is the shingles vaccine or the chickenpox vaccine.
The chickenpox vaccine.
It's fairly new,
I had the shot.
the chickenpox one.
And I had the shingles. In fact, I still got this thing, the markings from it.
From the shingles.
Mm-hmm.
You had the chickenpox vaccine, though?
I had the shingles shot.
You had the, yes. So as you get older, the percentage that the shingles vaccine prevents the disease, the virus, gets lower. So if you have a chance to get it, every Medicare Part D plan covers the shingles vaccine. It's called Zostavax. It isn't free necessarily, depending on your plan, but they do cover it. So Medicare Part D is your drug plan, which means that it would be covered at your pharmacy, and most pharmacies give vaccines. It's now approved for anyone aged 50 and older, and at age 50 they say that it's maybe an 85% success rate of preventing shingles. As you get older, it's at least a 50-50 chance. And the other thing is, it can, at the very least, it can lessen the severity of the disease if you get it. I know someone right now that did get the shingles vaccine. He does have a case of the shingles, but at least as of right now, he said it's very minimal. But the doctor did diagnose it as shingles. So people that have had the more severe cases of shingles, because it affects the nerves, you can have tingling, itching, burning feelings for months and months and years afterwards. So in my opinion, and obviously this is an opinion, but it's worth getting the vaccine if you can to, hopefully either lessen the chances of getting the disease or lessen the chances that it will be as severe. The most I've seen for a copay is $80-some, I think, but the vaccine itself without insurance is over $200. So
170 something?
I don't remember.
did you get it at the pharmacy?
No, I had,
No.
which,
The shingles vaccine?
no, I had it when it first came out
Oh,
in my doctor's office.
so it wasn't covered?
Well,
I
this-
had to
the-
pay
the
like
vaccine was-
80-some,
It
or,
was $100-some for
Yeah.
just administration.
It's not that bad anymore because, like I said, all Medicare Part D plans do cover it, so the cost of it is generally not that bad.
But it has to be, doctors have to have a prescription or something?
If you call the pharmacy, in my pharmacy's case at least, I will contact your doctor and make sure. There are some people that should not get the shingles vaccine. If you have an allergy to gelatin, the antibiotic neomycin, those two things would make you not eligible for the shingles vaccine. If you have a weakened immune system, they recommend not getting it. It is a live vaccine, so which means it's live attenuated. So it's like a they call it a shortened, basically it's a shortened version of the live vaccine. It will not give you the shingles, but a live vaccine is just it's more active, so it makes your body more likely to produce those antibodies to fight shingles should you become exposed to, somebody with chicken pox. It's possible that, somebody with chicken pox who you're around, maybe can give you the shingles depending on the state of your immune system.
By coughing and persons?
I don't know. Yeah, generally it's contact. As far as like the chicken pox being spread, generally it's by contact. So when you get the shingles vaccine, you don't want to be around like a little baby that hasn't had the chicken pox or the chicken pox vaccine for a couple of weeks, because you can potentially give them the chicken pox.
Shingles themselves contagious?
No, not to another person who has had the chicken pox, but it can be contagious to somebody who has not had the chicken pox. If you have open blisters or something like that, generally by contact only. Not by, it's not a respiratory illness. You're not going to cough and spread the shingles to someone or sneeze or something like that, but by contact, I would say it's a possibility.
So if you have the chickenpox vaccine and you don't have chickenpox, you may not suffer with shingles?
Yeah, the shingles vaccine is new enough, and as is the chickenpox vaccine, I would say that I don't know that they've come up with a recommendation, and I've asked this question a few times too, to say, so what do my kids do down the line, when they've been vaccinated against chickenpox, so they're not going to get chickenpox. I would assume they would still need the shingles vaccine, because being given the chickenpox vaccine is going to put those chickenpox antibodies, the varicella antibodies in your body, which, I would assume would mean that you could get shingles. So I don't think it would change the shingles recommendation. In fact, it probably means, really everybody should get the shingles vaccine. So those are the recommendations for shingles. Does anybody have any more questions on the shingles vaccine at all?
Well, when we were kids, our mother would say, well, let the kids get the chicken pox when they're small, because they don't suffer, it's not so severe until they get older.
Right, and generally that's the case. Most people don't have complications from it. Most people, it's uncomfortable, but it's not a problem. However, I don't know what the percentage is, but there is a small percentage of people that have, pretty serious reaction to the chicken pox, whether it's, fever or, things like that. And so I guess the idea is, why expose someone to something that you could potentially prevent with a vaccine that causes a day's worth of discomfort, and then it's done. So, any other questions on that? So it is flu season already. You wouldn't think it, but it is. And at the pharmacy, we do have our vaccine in. We have both the regular vaccine and also the Fluzone high dose, which is recommended for anyone over 65.
It's the same thing, just different doses?
It's a higher dose. So as we get older, our immune response goes down, and so that means we need a higher dose in order for our body to produce the same reaction. And since the older population is more susceptible to complications from influenza especially, that's why they recommend the high dose for anyone over 65. The flu vaccine is also covered by Medicare. It's covered at the pharmacy or at the doctor's office. At our pharmacy, we don't require an appointment at all. You just have to stop in, fill out some the questionnaire that comes along with any vaccine, you know, as far as are you healthy enough to get the vaccine today. And then we bill it right through your insurance right then and there.
Do the shot.
We do the shot. Yep. Yep, we do. So at the pharmacy, we give shingles shots, we give the flu shot, we give pneumonia shot, we give the tetanus shot. There's lots of other possibilities, but those are the most common ones.
You run it through the insurance.
Right. Yep. We run them through insurance. So with it being almost October, some people think, oh, I should wait to get my flu shot. I have a friend that had, when H1N1, the swine flu was first out, I don't know, however many years ago that was, a few years ago, she had that in August. And she was absolutely miserable. You know, the vaccine is meant to last forever, basically. The only reason that we get a shot every year is because they change the strains that are out. The virus mutates every year. So there's really no too early time to get the flu shot. It's best to be protected as soon as you can from influenza, because influenza obviously has some very serious complications should you come down with that. Now, when I'm talking influenza, we're talking respiratory influenza, not when you get vomiting or diarrhea, those kind of things. That's not influenza. That's a stomach virus, but it's not influenza. The influenza that you get the shot for is actually the respiratory influenza, and it includes generally some severe aches and pains, fever, coughing. It's really awful, and I hope that nobody ever has to experience it, because if you haven't already, because it's really awful. So like I said, I would push for everyone, if you haven't had the vaccine yet, to try and get in and get it done as soon as you can. I know the clinic has a few vaccines in, if you prefer to go there. Otherwise, we have quite a few at the pharmacy.
Why does it always hurt? I had mine like a week ago and it still feels like somebody punched me. It's always the flu shot that does it.
And I got mine probably a week ago and I can't even feel it.
Oh.
It may be in,
Is it how to hit the muscle maybe? or something?
it may be, yeah. It may be, closer to some nerves.
Sometimes it doesn't hurt. Every year.
Every year it hurts you.
Do it the
For
other
like
side.
a good week and a half, 2 weeks.
It's meant to be given intramuscularly, so it goes into the deltoid muscle in the arm here. The shingles shot is a subcutaneous vaccine, so it's a real short, just a ½ inch needle, whereas the flu shot is 1 inch to 1.5 inches. So it seems long, but turn your head the other way.
Yeah, right up. Oh.
Trust me, first time I gave them, I didn't like the idea of poking someone with a needle that long either, but
No, it's fun, huh?
you get used to it. Oh, I warm up and get ready. No, so it is given intramuscularly, so it can leave a sore arm. Yeah. I did attach this piece of paper also in the packets to say, is it a cold, influenza, or pneumonia? Just because, sadly, a cold you can go to the doctor for, but chances are they're going to say, get plenty of fluids, take some Tylenol, rest, comfort measures basically is what they're going to say. And by that point, you've wasted a trip to the doctor's office. The influenza symptoms or pneumonia are obviously more severe, and those are things that you do want to make sure to make a visit to the doctor for. Influenza itself generally has a very high fever associated with it. If you go to the doctor right away when you start having these symptoms, there are antivirals. It's called Tamiflu is the medication that they frequently treat with, that can sometimes reduce the duration of influenza. It doesn't always help, but again, it's something that if I got the flu, I would take it because I would want to try and feel better as soon as I could. And it depends on the severity of your virus and all those kind of things, whether or not they would prescribe it or just, do the same as the common cold and say get plenty of fluids and take some Tylenol or ibuprofen for, the discomfort and the fever and wait it out. People are sick with influenza generally for at least a week. And it's pretty miserable. My friend had it last year at Christmas, and she said, I literally could not open my eyes for like 3 days. She just felt so awful. And she's my age, so it doesn't, imagine someone who's, 90 years old and not in the best health, getting influenza. They get something like that, they end up in the hospital a lot of the time. So it's best to try and avoid it. Vaccines are not perfect. The flu shot, they put the 3 most common strains that they've seen over the last year in the vaccine. Are there going to be other strains out there? Of course. During the winter season, we got to practice good hand washing and obviously covering with our arms, not our hands, so that we don't shake the next person's hand and expose them to whatever we just coughed into our hand. There's other precautions besides the vaccine. Not everybody wants to get it, but, and like I said, it's not foolproof, it's not guarantee, but in my opinion, my whole family gets it, my kids get it. If it can prevent, some of the possibilities of flu, why not?
A lot of people say, well, I don't get the flu shot because I got the shot one time and it gave me the flu, so I'll never take the shot again.
And that's not true. So it's a matter of coincidence that they got the flu right after they got the shot, possibly. Maybe they had a weakened immune system already, they had been exposed to it. The vaccine is not going to give you the flu. It's a dead vaccine, it's an inactivated vaccine. It's not going to give you the flu. The worst you're going to get from the flu vaccine is possibly a low-grade fever, which is a good thing because it means that your body is actually responding to the vaccine and working to produce those antibodies so that should you become exposed to the actual virus, hopefully your body can fight it and you don't end up with the horrible symptoms that put you in the hospital. But that's a very good question, and that's a good reason that a lot of people say, oh, I'm not going to get it because I got the flu.
Yeah.
Well, it does not give you the flu. That does not happen.
And what was the flu? Was it the vomiting or was it?
Right, and that's the other thing. That's the reason that I pointed that out. The influenza vaccine does not prevent the stomach virus. It does not prevent the vomiting and diarrhea aspect. That's the stomach. That's similar to the common cold. It's just a matter of, basically all the time we just need to be practicing good hand washing. It's no different than me talking to my kids about, what they need to do. Everybody needs to practice it, and I think, it's easy to get busy and forget and things like that. I know there's that antibacterial.
Is that as effective as washing your hands?
The antibacterial stuff. I mean, it's like putting rubbing alcohol on your hands. It can kill some things, but when you wash your hands, they always say to the kids, sing your ABCs twice while you're washing your hands. So you're getting not only just you're rinsing with water, use warm water, as warm as you can tolerate. That seems to me more effective.
Antibacterial versus just soap.
So there's been debate in general about antibacterial products because, we have bacteria all throughout our bodies, and including our hands. It's not all bad bacteria. It's mostly, just like dirt or oil or whatever else that lives, that stays on our bodies. So some people say that using antibacterial stuff kills off, good bacteria. I don't know that just washing your hands with antibacterial soap is gonna be either harmful or helpful. I mean, just the plain fact of washing your hands.
They say I think it's the friction, isn't it? That
Yeah.
actually is doing
Even
it.
when you wash your dishes, they say you don't really need to use soap to wash your dishes.
Yeah.
Well, I know.
Yeah.
I use
I do.
soap, but I've heard people say you don't really need to use soap. It's more the actual friction, the rubbing aspect of washing. So.
Dishes would be awful dirty then.
Well, I think sometimes, to cut grease and things like that, you have to have something that's going to cut the grease. So, that's the information on that. The other common vaccine that's somewhat new, actually, is the pneumococcal vaccine. You probably all got at least one pneumonia vaccine after you turn 65. In the last couple years, a new vaccine has come out, and it's called the Prevnar vaccine. So it's a pneumococcal conjugate vaccine, and it has 13 additional strains of pneumonia in there, and they do recommend that you all get that Prevnar vaccine. This is something that we give at the pharmacy. I did put this sheet in your packets that tells when you should get the pneumococcal vaccine, which pneumococcal vaccine you should get. And we do give both of them at the pharmacy. So if you're age 65 years or older, no matter what, you need to get a pneumonia vaccine. If you've never had a pneumococcal vaccine, then you would first get the Prevnar, the conjugate vaccine. And then after a year, then you would get the Pneumovax. Most people have already received the Pneumovax or the PPSV 23, so most people are in the second category.
I got a shot, and he said I don't have to get it anymore.
When did you get it?
When I was in the hospital a couple of years ago.
At that time, they said that to me too. One with
I'm
pneumonia.
going to guess that you probably had gotten your pneumonia shot,
Yeah.
the PPSV 23, but I have access to the Wisconsin Immunization Registry, which would tell me whether you have gotten, in Wisconsin at least, if you have gotten your shot and also what's recommended.
When I go, they check it off, that you got your pneumonia shot, they just check it off, so that's.
Stop in and I'll look you up and see, but I'm guessing that you're probably due for the PCV 13, the Prevnar vaccine.
I just figured.
And
because
Medicare
of my age.
covers it 100%.
Do you have to, does your
Because
doctor
this is
have
the
to
lowest
recommend
one.
that, or
Yeah,
can you
once
just
they
go
told
and?
me I didn't have to
You
get
can
it.
just come in. I will check the Wisconsin Immunization Registry to see if you've gotten it or not, or what's
Do
recommended.
you look up people by name?
But
Yep.
now they say
Name
it's
and
in
date of birth.
Oh,
How about the VA?
But you have to have access to that, not you couldn't go and look it up.
no, I mean, could I stop in and
Yep.
have you look it up? Oh,
Mhm.
okay.
Can you look up for if I had it at the VA? I think I had it.
Possibly. I can look up if they registered it with the WIR, the Wisconsin Immunization Registry, then it would be in there. Any vaccine that we give, we put on the Wisconsin Immunization Registry so that all the doctors' offices can access it, healthcare providers can access it to make sure that they know what vaccines you're due for. They can say, okay, I looked it up and you did have your flu shot last year. Or, because the shingles vaccine is only recommended one time, they can say, okay, yes, you received your shingles vaccine, so you're not due for that. Or they can say, yes, you've received 2 doses of your pneumonia vaccine, which would be the Pneumovax, the 23, but you have not had the PCV 13, and so you still need that one. It's new within the last couple years.
But you can't get them both at the same time.
You cannot give both pneumonia vaccines at the same time. You wait about a year in between the vaccines. But the pharmacy can give both,
Okay.
depending on what I would guess, Mary, that you're due for the Prevnar.
We'll check it out.
Yep. And Medicare covers it, so.
Will it hurt if you get it twice? Say if you had it, and you're not sure that you had it, and you go back in and say, well, I'm gonna give you this shot.
Well,
Would it hurt you?
I don't know.
double dosing.
Yeah. I mean, they don't study those things, you know what I mean? They're not going to study something that's not recommended exactly, so I don't know what the effect would be. Probably nothing, aside from another sore arm, because it is an intramuscular one, and I have had people say that that one hurts.
Grow another head, didn't hurt me.
You'll grow another head.
Well, the Prevnar, the newer one, some people have said that it hurts, and then I just gave one the other day, and she barely flinched. So, same as you with the flu shot, it's sort of a matter of, your deltoid muscle is all through here. If you happen to go 1 millimeter this way or 2 centimeters that way, it's still the deltoid, but you just may have, more nerves or something like that there. It just may be why it ends up hurting a little bit more. So any questions about the pneumonia vaccine? I also put this chart that just shows, this is for children and adults, what the pneumonia vaccines that they should receive, when, and why. Because some people actually under age 65 receive the pneumonia vaccine depending on, what underlying diseases they have or conditions. Asthma is something that obviously predisposes you to pneumonia, so we want to make sure that you don't end up with pneumonia. So that's just something to look at. The one other one that is somewhat of a newer recommendation is the tetanus shot with the pertussis. Now, most people stay somewhat up to date on their tetanus shots, but up until, I don't know, maybe 8 years ago or something like that, they thought everyone was, covered just with the once every 10 years tetanus shot. Those tetanus shots had just the tetanus and diphtheria protection, not pertussis. When we're younger, we all got, well, I did. I don't know what you guys got, but when people are younger, they get the tetanus, diphtheria with the acellular pertussis. They used to figure that those childhood vaccines with the pertussis were enough to protect us, but they've now obviously since realized, now that we've had more whooping cough, which is what pertussis is. Yep, pertussis is whooping cough, that people do need a pertussis booster. As of right now, the CDC only recommends one extra pertussis booster, which the pharmacy we do give. And in fact, I know from some of the doctors that I've talked to, they've said that Medicare does not cover it at the doctor's office. It does oftentimes.
You have to go over to the courthouse and have the county nurse give it. I just had mine done last year.
Did you? Yeah. So the pharmacy can.
No, my
Tetanus?
tetanus shot.
But they probably, if you were due for it, hopefully they gave you your pertussis, and we can check
Yeah,
that.
it was all together.
Okay, yeah. So it's tetanus, diphtheria, and then it's usually acellular pertussis. So it has all three of them.
I don't have to get any again.
In the pertussis one, you don't. You will still have to get your tetanus shot in 10 years.
Oh, forget that.
I am allergic to tetanus,
Okay.
so what do I do?
Don't cut
Don't
yourself.
touch yourself with
Yeah.
anything rusty.
You had an allergic reaction to a tetanus shot? You be careful. I mean, most whooping cough, is treatable with antibiotics. It is a bacterial infection. It's just that, again, as people get older, just like influenza, your reaction to, something like whooping cough gets worse. There's no just plain pertussis vaccine, unfortunately, so if you're going to get the pertussis vaccine, you'd have to get the tetanus with it. What kind of reaction did you have?
A large red area, itch like you wouldn't believe. It was hot.
Yeah.
So, and
I mean, they could say pre-medicating with, I can't see what that says.
TDAP.
Yep, tetanus, diphtheria, acellular pertussis. Yep, so that's the one that you're good,
For how long?
10 years.
Okay, we can forget that.
If you have pertussis.
Well, why?
You
as a
can get it
child,
again.
You can get it, okay, and does it normally come as a?
It's a respiratory
Yeah,
illness.
no, but I mean, does it normally come with the tetanus?
It
Is that what
doesn't-
you normally would?
No. So, as a kid, we got the tetanus, diphtheria, acellular pertussis vaccines.
No,
Then
I wouldn't have had that.
Then-
I had pertussis as a child.
you had whooping cough?
I had it, yeah.
Okay. So then
As
the
a
tetanus shots that you would have gotten as an adult would not have
Would
had the
not have had it
pertussis
then.
in there.
So I should probably see about that then.
And again, you can stop into the pharmacy and I can look it up in the Wisconsin Immunization Registry.
Okay.
Most people, you know, it depends. Doctors' offices aren't as pushy about getting that shot as they are like, you know, the pneumonia shot. They want to make sure that they're preventing, obviously. But it can be, obviously, if you had it as a kid, it wasn't great, and it wouldn't be great even as an adult. So, you know, it is treatable with an antibiotic, but similar to influenza, you know, it can take a recovery period, and which isn't ideal. So pertussis is a bacterial infection. Influenza is a viral infection. So they're treated with different medications. That's why I mentioned the Tamiflu as an antiviral. If you do get influenza, and they would use an antibiotic if you had pertussis or whooping cough. So,
I have a question about the tetanus. You get a tetanus shot good for 10 years, but if something happens and you cut yourself, you poke yourself with a nail, they give you a shot again. Is it just a precaution?
just a precaution, yeah,
It doesn't hurt or nothing, it's just.
right.
you see it happen.
They always say, is it current? You go, I don't know.
Yeah, yeah.
Right.
10 years, I got it 9.5 years ago, I
Yeah,
think.
9 years, 8 months ago. Who remembers that?
Yeah, and they do have the ability, you know, obviously if you're at a doctor's office or an emergency room or something like that, they have the ability to look it up.
Really?
But, you know, the other thing is, if you get vaccines at our pharmacy, I will fill out a card for you that has, you know, if I give you your shingles shot or I give you your flu shot this year, if I give you the pneumonia shot, I'll write that you got the Prevnar, or, you know, you got the Pneumovax, or, you know, you got the Zostavax. So I'll give you a card, because most people don't have those anymore, and it's kind of nice to keep on hand.
Yeah.
I know for my kids, I have no idea where they're at with their vaccines. I just go to the take them to, you know, I'm a pharmacist, but I just take them to the doctor and say, are they due for any vaccines this time? You know, they get their flu vaccines. They're lucky they get the nasal spray instead of the shots right now.
Is
But
that as effective?
it can't be given to older adults. It's a live vaccine. The flu mist, or the nasal one, is a live vaccine. So yeah, it seems to work. But they recommend it for all kids aged 2 to 8. So.
So we wouldn't qualify, huh?
Yeah, right.
Maybe. You might just meet the deadlines.
Which one?
The 2. That's what your wife said. You act about like a 2-year-old, right?
Listen to her.
Okay. Well, I don't really have anything else to present, really. I did put a little information about our pharmacy on the front of the packets, just the services that we provide.
Where are you located?
We are located next to China House.
By Kmart.
Yep,
Okay.
up by Kmart. So you turn up Western Avenue, and it's where the embroidery store used to be, at the back of that building.
Team Outfitter.
Yep, Team Outfitters is in that strip mall. Waupaca Woods used to be at the front of that strip mall, and I used to work for Waupaca Woods Pharmacy. And then when we were sold to Kmart, I opened about 2.5 years ago. So
Shopko,
And Gunderson Cleaners. is
Gunderson
right
Cleaners is
there.
in there. Yep, exactly.
Is it Shopko, not Kmart, wasn't it?
Shopko. Waupaca Woods sold to Shopko when they came to town. No,
You said Kmart.
we're next to Kmart. I said Kmart?
Yes, you
Across
did.
You
Oh,
sold.
we were sold to Shopko.
Across.
Across the street. Yeah, basically they just sell the prescription business, and so anyone who had prescriptions at Shopko, their prescriptions automatically went to, anyone who had prescriptions at Waupaca Woods, their prescriptions automatically went to Shopko. And then when I opened, then
Then I came.
Lorraine followed me.
Then I followed.
It is very easy to transfer prescriptions if that's something that you're ever interested in. You literally just stop in and we take your name, address, insurance information, and we call whatever pharmacy you currently go to and transfer the prescriptions. If we need to talk to the doctor to get a prescription, we make the phone call to the doctor. You don't have to do any uncomfortable interactions with anyone telling them, that you're switching or why you want to switch or anything like that. We do it for you. I am giving a talk on October 8th here. I don't know if it's in this room or not, but on Medicare Part D, and just some common information, some common questions that people have about Medicare Part D. It's a pretty complex topic, and it doesn't get any easier the more experience that you have with it. I have been a pharmacist now for about 10 years, and it's still confusing. It changes every year, and so it's definitely confusing. Our pharmacy will go through your medications to help you pick a Medicare Part D plan that would be best for you, because every Medicare Part D plan is different as far as what they cover. For people that are on more complex medication regimens, we will do bubble packing or compliance packaging. It's kind of like putting, those medication caddies that have the morning, noon, evening, and bedtime. We can do that for you, and it's just a $10 monthly fee. So that way you get all your medicines filled at the same time, and they're all set up and organized as far as what time of the day you take them and what day it is and things like that. So if you haven't been to the pharmacy, we also have a really fun gift shop. Mary will be bringing back some of her scarves pretty soon. And we've got lots of fall stuff and some
Free drugs are the best things.
no free drugs, sorry. What did you say, Mary?
I say it's a neat little shop.
Yeah. For the small area that we have, I think we, have a decent amount of stuff in there. So, yeah, no problem. Thanks for having me.
Thank you.